Good morning, everyone, and welcome to Chamber Chat. We're delighted to have you join us inside the Chattanooga Chambers Connection Conference Center powered by EPB. I'm your host, Sharon Law, Business Development Manager for Thompson Engineering and Policy Committee Chair for our Chattanooga Chamber of Commerce. We have two very special guests with us today. Dr. Andrea Willis serves as Senior Vice President and Chief Medical Officer at BlueCross BlueShield of Tennessee, and Sherri Zink, Senior Vice President and Chief Data and Engagement Officer at BlueCross BlueShield of Tennessee. We're here today to discuss their first ever health equity report available to read at bcbst.com. Or for our viewers at home, you can find the link in the description below. Sherri and Dr. Andrea, thank you so much for being here. Let's give them a big round of applause.
Thank you.
There's a lot to say about this topic because it's so important to many people. First, how does Blue Cross define health equity?
Well, I think it aligns with the definitions that you'll see from the CDC and others, and that really is the ability of everyone to achieve their optimal health. Stated another way, it's the right that everyone should have to achieve their optimal health. So it's not just about what the person does, but it's what the healthcare system and all the ancillary services does to wrap support around the person to remove all barriers so that everybody truly does have equal access to quality healthcare.
Yeah, and I think just to add to that, when you think about people who are dealing with a health issue, what we want to make sure of is that everyone has the same chance to have a positive outcome when it comes to their health.
Great. This is the first time you've released a public report on health equity. Why now?
Well, one thing that we saw during the COVID pandemic is that health disparities were exacerbated. And we just felt like we could not go on with us being a health plan and part of the healthcare system and part of public health, as far as I'm concerned. We couldn't go on not addressing these things. I mean, it's been something that's been fundamental to who we are because we always try to serve a diverse population, and we think that we do that well. But this called for us to take it a step further.
Yeah, and I think, let's face it, we can't do this alone. We're going to need help from our communities, our providers, our employers to really move the needle. And, we're going to need help collecting more data so that we can make sure we have accuracy when we report out this information. So that's why it's extremely important for us for the public to know and be aware of what we're seeing in this information.
Well, let's talk about the impact of this report. Why do you think there's value in reporting this kind of information to the public?
It really lays it bare. It lays it bare from our perspective. We want to do everything that we can to advance health equity, and it shows where there's opportunities. And we don't mind that being out there. We don't see all of our screening rates as high as we would like to for preventative type conditions. We don't see the outcomes where we would like to see them across all demographics as well. So we wanted to lay it bare, but also to issue a call to action to everyone in the community that has a heart to do the same thing. It's nice to have something that people can rally around, something that actually starts to show where there are gaps, and it'll also show when we have some progress.
Yeah, and back to the thought around, how COVID kind of shone a light on this. I think the other thing that we wanted to make sure of is that people had an awareness that this was bigger than just COVID. We see this in a lot of other areas, and we felt that was extremely important to showcase.
What can our community, and specifically our business community, do to help?
So it's amazing. When you think about healthcare, I think a lot of times people think about what happens in the clinic or in the doctor's office, but so much of healthcare actually happens outside of clinic walls. Mm-hmm. So it's about the environment. It's about, where people sleep, where they work, where they play. So employers have a lot that they can do. I know that we're having employers now that are coming to us saying we want help in this because we want our employees to know we see them. They're not just a mass of people, but they have different needs. And a lot of it could be based on their environment, the environment they go home to. So I think really taking that step back and looking at who your employees are and the barriers that they have, will help us to create something together that will help to address those barriers.
Yeah, and I think one of the things that we are seeing since we released this report, I mean, we're seeing, having a lot of employers call us and say, well, what does my data look like? Or what does this look like in a specific region of Tennessee? What is it in Chattanooga? And so I think we've already kind of put it out there and it's created the awareness, and people are already asking really great questions. Right. And that was really the initial goal of what we were trying to accomplish.
Great. Well, this leads me to my next question. Many of us, and you mentioned this earlier, think health is primarily about our genetics, or that it happens in the clinic, or our personal choices. But it sounds like there are social factors that influence it too. What are some of the factors you consider in the report?
So we look at different demographics in the report. So we look at white, Black, Asian, and Hispanic. So we want to see what differences exist, and Sherri's team does a great job at looking at the social vulnerabilities that might be in those communities. But another piece of this as well is making sure that people have access to culturally competent care. So if you have a clinic, say in a community where Spanish is the dominant language and nobody in the clinic that speaks Spanish, you might not get those people coming in the doors. Right. So it's really, again, looking at who the people actually are and what their needs are and how we can address those needs and the barriers.
Yeah, and just, if you go out and look at our report and look at the gaps in care that we're showing out there, when you look at those particular measures and metrics, what we're seeing is food, housing, and literacy are the three major ones. But when you start to look at, and take a deeper dive, there's also a lot of economic issues that we see as well, economic stability. So those are the areas that we really want to shine a light on and how we move the needle on those.
Okay. Exactly. And you asked before about what employers and businesses can do. One of the things I'm very proud of that happened in the Chattanooga area is when businesses came together with funding to improve broadband access. That was a huge deal because not only did it help the children that were having to do school from home, but now telehealth has expanded, but not everybody had the same access, even from their homes. And so I was so proud of the businesses that came together in short order to increase broadband access.
Yeah, and a lot of employers up front may not even know that there are social risk factors within their employee population. And we've had some employers who have kind of recognized that because they may see an employee saying, I need help paying my rent this month so that I can get my medication filled. And so some companies, have a fund that their employees can access when they're down on hard times. We have one at BlueCross BlueShield of Tennessee, and I think a lot of employers are trying to look at how they close that gap and help employees kind of, improve those social factors.
Let's look at the numbers. What can you tell us from the data about how those social risk factors correlate with racial disparities?
Yeah, I think a lot of times what we see is when we look at social factors and we look at the metrics, we do see, for example, in the Hispanic population, for example, because of the language barrier, sometimes we have to create better education materials, better awareness, and so they may have a lower gap in care, for example, than what we see with another population because of that language barrier. So it's very important for us as an organization to understand that and to help close that gap. So that's one specific example. I think the other thing is, depending on, where you live, there could be additional social factors related to specific areas of the state. And it's very important for us to kind of link those two because you really can't move the needle on health unless you're removing those social barriers that people have. Because if someone is going to, put food on the table for their kids versus go get their medication filled or go to the doctor to get their wellness exam, they're going to put the food on the table. So we have to really move the needle and, close that barrier for them.
A big part of this discussion on social risk factors and health disparities revolves around healthcare. How should this information influence the work of healthcare providers?
Again, I think everybody goes into the field because they want to help people, and that's still very admirable. But I think it has to go bigger than that. It really does have to look at the demographics, the environments that people come from, people have to feel empowered by the healthcare providers. And so it's really supposed to be a respectful partnership, your healthcare is. And so it really is about trying to get providers to see, again, people for who they are, the factors they have to go back and face every day. And then that gives them the personal responsibility. You can't ask somebody to have personal responsibility if they haven't had a conversation that empowers them, that educates them as to how to take that personal responsibility.
Yeah, that's right.
Yeah, and I think, some of our providers don't even, as part of their plan, don't really even ask those questions, right? And so one of the things that we're trying to do is educate providers on what's available from a community resource perspective, why it's important to address that whole person, not just those health issues, but also those social inequities that we may see. And so I think it's important for us to educate our physicians on how we do that and empower our providers to have that information at their fingertips. And so that's a definite area of focus for us.
Absolutely. And who even that they employ in their practice. If they can't accomplish everything by themselves, maybe it's that front desk person that speaks Spanish is what they need. Maybe it's a nurse that, is bilingual, things like that. So it's just important to really take a look at not only who's coming in the office, but who's not coming to the office.
Yeah, it's a very thoughtful process. Here's a question that will relate specifically to our business audience. If I'm a business owner thinking about the health of my employees, what do I need to know about social risk factors and health equity?
Again, I think it's really just trying to think about the environment that your employees go home to. I think a lot of times we try to make sure the work environment is optimal for our employees, but the home environment is just important. If we think about during the pandemic, we had a lot of focus on essential workers. Those were the workers that, worked at the grocery stores, that drove buses, that did all these things that we found essential. I think we just need to make them feel essential every day. And healthcare is one of those ways, again, really taking time to see what they need. I know for us, even in our work, the very first question we ask is, what can we do for you today? I think it's a similar question for businesses, especially when you're seeing some of the things, and businesses do look really hard at where their spend goes as far as healthcare to figure out what might be the root cause of that. And then we love working with businesses to try to solve for the root cause.
Yeah, and I think, kind of back to what I said earlier, I think just really understanding their own population and where there might be social risk factors associated with that population and really understand, because it starts there. Just like us, we wanted to create awareness of what was going on. And so I think creating awareness within your own company about how this looks for your particular population and kind of the strategy that you have to address those issues. Because again, back at the beginning, we talked about it's going to take all of us to really move the needle on health equity and health inequities that we see. And so, we think it's going to be important for businesses to also look at this information, determine how they're going to address it, and then also educate their employees about these issues.
Absolutely, and start to collect data. Businesses can collect data about their employee base, and I think a lot of times that's not done, but that would be very, very helpful. Businesses could even consider a focus group when it comes to healthcare of their own employees. You might be surprised what you hear, but I think it at least paves a path forward.
Yeah, and I think back to what you're saying with the data. The data is very important because, we want to collect as much direct data from our members as we can. We don't want the data to be imputed or come from other sources. We want to hear it straight from our members. And I think the way that we can really move the needle and make sure we have this as accurate as possible is for, business owners to kind of help us collect that data, because we can't really do it on our own. We have certain ways that we can collect it, but I think businesses can really compile that information for their employees much better than we can.
Okay, well, this is our final question. Why should health equity matter to everyone in our community?
I always say this, it should matter because it's just the right thing. It's just the right thing. Everybody deserves the right to their optimal health care. And then for the healthcare system in general, if you can serve the most vulnerable, then it ends up being a win for everybody because the system improves for everybody.
Yeah, and I think just, in our community, having a healthy community means you've got a healthy work environment, means you've got, healthy people. And so I think it's important that, when we focus on this, that we think about how, the focus on health really helps you live a better quality, happier life. And all of us should care about that, and we should care about each other.
Okay, last question, part B. How can we help make that a reality?
I think we have to be intentional. I mean, we did say at the beginning that, the exacerbation of health disparities during COVID was something that we just really felt like we needed to highlight, but we needed to show the bigger picture as well. And I think that a pandemic did bring out a lot of focus on let's do the right thing, let's do the right thing. So I think the big thing is keep being intentional about that. We can't make this be just a moment. We have to turn the moment into momentum.
Yeah, and I think that, kind of what you're saying, we have to take action. I mean, just putting a report out there and, and not taking action on it wouldn't get us very far. So I think it's going to be important, and while we're kind of educating folks in the community today, is we want to be accountable for that, and we want to take action on it. So I think it's important.
Great. That brings us to the end of another Chamber Chat session. Thank you for joining us today, and thank you to our viewers watching at home. Again, you can find the entire Health Equity Report on bcbst.com or through the link in the description. Stay tuned for our Q&A. One more time, let's give our guest a round of applause.
Thank you.